Hey guys, good morning, good afternoon, good evening from wherever you're participating from. My name is pharmacist Ibube Samuel. I am the state liaison officer for CPACPI in Edo State, Nigeria. And I want to welcome you all to this video. And I'm going to be very quick and brief about my presentation. I'm going to be quickly describing for us the various criteria for enrollment into the various bands of the CPACPI. Now, for those of you that are new to this channel, CPACPI stands for Community Pharmacists Career Progression Scheme. Okay, or in other words, Community Pharmacists Assessment and Career Progression Institute. That's the full meaning of CPACPI. Okay, so now for the band one, we are looking at you having 1 to 3 years of community pharmacy practice experience. Okay, so we are going to be assessing you for this. Then, of course, your current PCN, ACPN, or PSN licensure and registration. So that means, for example, this video is being done in 2026. You should have paid for your license as at the time of this video. Then there ought to be evidence of provision of pharmaceutical care. Okay, you know that pharmacy has advanced from apothecary stage or maybe compounding stage, to just normal dispensing. Now we go beyond dispensing to ensuring that we have what we call both economic, clinical and humanistic outcome for our patients. So there has to be evidence either by way of you documenting data for the patients you consult every day. So you just have to make it available because, like we say, if it is not documented, it is not done. All right. So quality self-assessment reports, digital tool use for pharmacy care services, maybe your use of Medscape and all those digital tools that help you to quickly get information, evidence of ethical practice. All right. So, more criteria for enrollment, we are continuing for band two. We say you should have greater than 3 years of community pharmacy practice experience, and you should have your current licensure, evidence of provision of pharmaceutical care, plus quality assessment reports. All right, quality assessment reports. So, then digital tool, like we have emphasized, evidence of ethical practice. For example, you should be able to provide your poison book. If a patient walks into your premise and can get diazepam without you logging it into your poison book, it is highly unethical. So you should provide evidence of ethical practice. And I just give you an example. Pharmacy conference attendance, that means you are expected to have attended at least one or both of PSN conference, either PSN, in fact, majorly PSN national conference or even the one in your states. All right. Then you can also attend that of the technical groups. We have several technical groups in pharmacy practice. We have ACPN, Association of Community Pharmacists in Nigeria, which is the one we use for this evaluation. We have other technical groups. Okay, so either ACPN or PSN, you should provide evidence that you've attended at least one conference. Scientific presentation, abstract, authored or co-authored. Now I want to explain this part. Now, for some of you that are not writers exactly, you can actually collaborate with your colleagues in the academia that are writers. And I'm happy to announce that ACPN now has an internationally recognized journal. You can publish there. And for those of you who want to find out what exactly can I publish, of course, I will try to leave my email at the description box of this video. But come to think about it, the community pharmacist has more raw data than most healthcare settings. How do I mean by that? Any common person with a common ailment, like say common flu, easily approaches you. They don't go to see the medical doctor. They want to save money. They don't want to buy hospital card. All right. So if you can document, if for example you've been practicing pharmaceutical care and you're able to document incidents of, let's say, common flu in your area, you can actually publish data, yes, showing the bioburden, in that area and steps you took to mitigate it. So try to think outside the box. There is always something to write. If you don't have a new data to compile and write something on, research on what has been done before and write something and publish. Because remember, the books you read today, someone wrote it years ago. So WAPCP Part 1 enrollment. And then business or financial management training certificate, you should be able to show that at least, pharmacies both practice and business. So you should be able to show that, yes, you've attended a business summit. I think there's one they used to hold in Lagos. I think either before or after a CPN conference every year. because this video is not about it, but just stick to your chairman, your state chairman. They will tell you there's always a business conference hosted in Lagos every year, particularly for community pharmacists and every pharmacist that want to advance in their business. So your state chairman will let you know when it's time. All right. So level one self-care COPAC or COPA quality certificate. So for band three, of course, I don't want to make the video too long. You can see greater than 6 years of community pharmacy practice experience. So that means if you started community practice in 2020, let's say January 2020, by now April 2026, that should have been greater than 6 years, right? Excuse me. Current licensure, evidence of provision of farm care, quality self-assessment, digital tool, every other thing that you have in the band two, in addition to mentoring pharmacists or pharmacy students. So we expect at this level you would have mentored pharmacists or pharmacy students. So for those of you in the states where you are, for example, I'm in Edo State, I've been able to mentor over 10 pharmacy students at the time, because now they are no longer students, they have graduated. Okay, over 10 of them during their IT. So I'll encourage you, open your pharmacy to mentorship. You can approach, if you are in a particular state, approach the federal university there. Tell them to send their students that are undergoing IT to come to your premise, even if it's for a month. Do you understand? And provide adequate mentorship. Expanded services like ART refuse. Know what that means? Antiretroviral therapy, okay, and NCDC clinic. So these are basic things you can do, all right? Yeah, so it's called expanded services. So evidence of ethical practice, conference attendance, and now advanced training certificates like MCPD. Do you understand? Or CPACPI or PCN accredited courses. So if you have not enrolled for your MCPD, I will really encourage you to do that, and do that as fast as you can. Okay. Evidence of primary health care service training on vaccination if or reproductive health. Then business of financial management training certificates. Robust business structure. Like you should have a business plan. Do you understand? Yeah, there should be a business plan to whatever. So at least at this band three level, we're also expecting that you should have at least registered a pharmacy, yeah, in your name. Yeah, because the only way having a business plan is that you have a pharmacy already. So but if you haven't, it's still not a problem, but at least you should have a business plan that you hope to work along. Remember, the reason for the CPA is to ensure that pharmacists are progressing in community practice up to the consultancy cadre, and that is what we are aiming for. Okay, so getting there in a moment. Collaboration with other healthcare professionals, like I would always say, as far as I know, as far as I'm concerned, it's always the healthcare team. That's how I see it. I don't see pharmacists, I don't see medical doctors, I don't see med lab scientists, I don't see nurses, I see the healthcare team. So whether you're in a community practice or anywhere, I always believe that you can always, for example, while a medical doctor send a patient to you with a prescription, you cannot make out the right thing, and you are using torchlights as though you were not seeing properly before. Call the medical doctor. I do that a lot in practice. Call the medical doctor, sir, Oma. You wrote this for this patient. It's not legible. Please, can you tell me what you wrote? There's nothing wrong with it. It doesn't mean you don't know your job. You are seeking clarity. All right. So that's important. Now, for band four, we said you should have greater than 9 years of community pharmacy practice experience, current licensure, every other thing we talked about. Then I am going to add uh, evidence of primary healthcare training and services, okay, collaboration with other healthcare, and then fiscal audits. So, like I said, you should have registered your pharmacy. So, because the CPA CPI team want to do a fiscal audit, to know how your business is running before we give you this band four. Then for band five, you're now a community pharmacy consultant. Now, remember, for these various bands, there are specific nomenclatures we attach to them. The preceding one we just saw is community pharmacy senior specialist. We actually started with community pharmacy. Okay, you'd have seen it on your screen. I just wanted to be fast with this presentation. So the band five, which is the cream de la cream, yeah, it's you have to have greater than 9 years of community pharmacy practice experience, every other thing that we talked about, plus, and of course, in the WACPC, sorry, there is this other certification that we require. If you have a master's in band three, it can also suffice. I just failed to mention that. Yeah, if you have a master's degree, it can suffice. So, robust business structure level 4, safe care, COPA 2 quality certification. Then, of course, every other thing, I think the major thing is that you have to have greater than 9 years of pharmacy practice experience. So, guys, meet your SLO in your state. Now, CPA is not just for Nigeria. Let me even emphasize, in case you are watching from any other country apart from Nigeria, you're a pharmacist. It's an international um it's an international program that's originated from Nigeria. Okay. So our ACPN chairman has actually traveled to, I think that should be Amsterdam, to deliver presentation on CPCPI. Okay. So wherever you are, if you love what we are doing here in Nigeria, you can actually adopt it. You can actually come to your country and sell the ideas. The idea is that we want to ensure that there is a defined career progression pathway for community pharmacists. Is that okay? So you can always reach out to me if you're in any state in Nigeria and you want to learn more about this. I'll put you through. Now, to register is just 20,000 naira in Nigerian naira, which is somewhere around $15 or less if you're in a country that still uses US dollars and all that. So register, but of course you can register and make payments later. Okay, so register for any of the bands you feel you are most qualified for and get certified. Of course, you can always reapply every 2 to 3 years for the higher bands as you deem fit. So I'll see you guys in the next video. My name remains Sammy Bube. I love you. Peace out.